A new statistical model just found something that's quietly unsettling climate scientists far more than the raw death toll itself, staggering as that toll already is. It's not just that Southern Europe recorded some of its deadliest heat on record this year, it's what the underlying mortality data reveals about how the human body actually breaks down once temperatures cross a specific measurable line, a pattern that's now forcing researchers to reconsider assumptions they've relied on for years of adaptation planning. Let's start with the scale of what actually happened, because the numbers alone are staggering before we even get to what's reshaping the science behind them. A statistical analysis from Christopher Callahan, a climate scientist at Indiana University, Bloomington, estimated more than 20,000 heat-related deaths across Europe during a single devastating week this past June, specifically the stretch from the 22nd through the 28th, when temperatures peaked above 104 degrees Fahrenheit across huge portions of the continent. Broken down by country, France bore the heaviest toll at an estimated 5,210 deaths, followed by Germany at 4,543, Spain at 3,163, and Italy at 2,709. This isn't an isolated statistical anomaly either. It's part of a devastating, escalating pattern researchers have been documenting for years. A separate study published in Nature Medicine, drawing on daily mortality records from 32 European countries, estimated that heat-related causes killed more than 62,000 people across the continent in 2024 alone, with Italy, Spain, and Germany bearing the highest overall tolls, and researchers noting that between June and September that year, the mortality rate rose by 23% compared to the same period just 1 year earlier. Spain specifically recorded 3,832 heat-related deaths between mid-May and the end of September in 2025, an 87.6% increase compared to the same stretch just 1 year earlier, during what was already the country's hottest summer on record at that point. The lead author of that Nature Medicine study put the significance plainly, stating that numbers of this scale are telling researchers it's time to fundamentally start adapting entire populations, rather than treating each new record as an isolated, unfortunate event. So here's the genuinely important question driving this deeper scientific reconsideration, one that goes well beyond simply tallying. Another grim record. Why is a single new statistical model generating so much attention within the climate science community, when researchers have already been tracking rising heat mortality for years and already knew the summer would likely set new records? The answer lies specifically in how this new analysis reveals mortality. Risk actually behaves as temperatures climb into the most extreme territory, rather than simply confirming that hotter summers kill more people, which researchers already understood well before this particular study. Callahan's model was built by fitting a statistical relationship describing exactly how mortality rates change as temperatures rise across different regions of Europe, then applying that fitted relationship to the actual conditions of this June's heat wave. What that model revealed is genuinely significant. Once temperatures climbed above 104 degrees Fahrenheit or 40 degrees Celsius, warmer regions experienced disproportionately greater mortality risk compared to what a simple, steady, linear relationship between rising heat and rising deaths would have predicted. In other words, the relationship between extreme heat and human mortality doesn't just continue climbing at a steady rate as temperatures rise. It appears to genuinely accelerate once conditions cross a specific, dangerous threshold. Not everyone has accepted these modeled estimates without pushback, and it's worth including that skepticism, honestly, rather than presenting the science as entirely uncontested. Some commentators skeptical of climate science have argued that modeled mortality estimates remain unproven hypotheses deserving considerable caution, pointing to cases where a specific modeled death toll figure didn't appear to align cleanly with provisional all-cause mortality data released by national statistics agencies. Researchers working in this field have responded that provisional all-cause data is itself an imperfect, frequently revised source, one that typically gets substantially updated over the following months as complete records are finalized, and that the entire reason sophisticated statistical modeling exists in the first place is precisely because raw death certificates dramatically undercount heat's true toll, since heat rarely appears as the officially listed cause of death, even when it directly triggered a fatal cardiovascular or respiratory event. That underlying medical reality is worth understanding on its own terms, too, because it explains why heat mortality has proven so genuinely difficult to measure precisely. That distinction matters enormously for how scientists and public health officials have been modeling future risk across the entire continent. For years, a working assumption within much of the adaptation research, the community held that warmer, historically hot regions of southern Europe had already developed meaningful physiological and infrastructural adaptations, air conditioning, building design, cultural practices like the traditional afternoon siesta that would help flatten the mortality curve even as temperatures continued rising decade after decade. This new modeling suggests that assumption may hold considerably less true at the most extreme end of the temperature spectrum than researchers previously believed, since the data shows mortality risk climbing sharply, rather than leveling off, precisely in the range where adaptation should theoretically be doing its most important protective work. If you're finding this kind of grounded, evidence-based breakdown genuinely valuable, go ahead and hit that like button. It makes a real difference helping this channel reach more people who want the real science behind these headlines instead of vague alarm with nothing to back it up. It's genuinely important to understand exactly how researchers even calculate a number like 20,000 deaths in the first place, because this methodology itself has become part of the broader scientific conversation. As one researcher at Imperial College London's Grantham Institute put it plainly, there's simply no ground truth when it comes to tallying heat-related deaths, meaning scientists don't have a definitive, universally agreed count to check their models against. Instead, researchers rely on statistical models comparing actual mortality during a heat event against a counterfactual baseline, essentially estimating how many additional deaths occurred beyond what would normally be expected for that time of year, then separately estimating what proportion of those additional deaths can be attributed specifically to human-caused climate change by comparing the real event against a modeled world without global warming. That methodology has produced genuinely striking results when applied elsewhere in Europe this year as well. Researchers at Imperial College, the London School of Hygiene and Tropical Medicine, and the UK Met Office found that 59% of heat-related deaths during the UK's May heatwave and 38% during its June heatwave could be specifically attributed to climate change, rather than simply reflecting a naturally hot summer. That kind of attribution work, distinguishing which deaths traced directly back to human-caused warming versus which would have occurred even in a cooler pre-industrial climate, has become an increasingly central and increasingly sophisticated part of how scientists communicate the real, measurable human cost of a warming planet to policymakers and the general public alike. Throughout the entire history of studying this problem, extreme heat doesn't typically kill through heat stroke alone. It worsens underlying chronic conditions, triggering fatal cardiovascular events, respiratory failures, acute kidney injuries, and even accelerating decline in patients with dementia and Alzheimer's disease. A death certificate in those cases will almost always list the underlying condition as the cause, not the heat that pushed an already vulnerable body past its breaking point, which is exactly why public health researchers have had to develop these increasingly sophisticated statistical approaches, rather than relying on straightforward clinical death counts. It's also worth situating this year's toll within the longer historical arc of European heat mortality, because the trajectory tells its own genuinely sobering story. Researchers studying the summer of 2022 found more than 61,600 heat-related deaths across the continent, a staggering figure given that it occurred even though, unlike during the catastrophic 2003 heatwave that killed more than 70,000 people, many European countries already had active heat prevention plans in place by that point. One researcher involved in that 2022 study noted plainly that the persistence of such a high death toll despite existing adaptation strategies suggests those measures may remain fundamentally insufficient against the scale of heat now being reached. Italy recorded the highest heat-attributable mortality rate that year at 295 deaths per million people, followed closely by Greece, Spain, and Portugal, with women and elderly residents consistently representing the largest share of victims across nearly every country studied. That demographic pattern, women and the elderly bearing a disproportionate share of the toll, has held remarkably consistent across nearly every major European heat mortality study conducted over the past 2 decades. And it connects directly back to why this newest finding about accelerating risk above 40 degrees Celsius carries such significant weight. Elderly residents, particularly those living alone with limited mobility or pre-existing cardiovascular conditions, are precisely the population least able to adapt behaviorally to genuinely extreme heat, meaning any evidence that mortality risk climbs disproportionately in exactly that extreme temperature range translates directly into disproportionate danger for the demographic groups already shown to be most vulnerable. At the end of the day, what makes this new analysis genuinely significant isn't simply confirming that Southern Europe just endured one of its deadliest heat events on record. Researchers already understood that broad trend was underway. It's the specific discovery that mortality risk appears to accelerate disproportionately once temperatures cross roughly 40 degrees Celsius, a finding that directly challenges assumptions about how much protection existing adaptation measures can realistically provide as extreme heat events continue intensifying. If adaptation strategies that once seemed adequate for a hot, Mediterranean summers start breaking down precisely at the temperatures now becoming increasingly common. That's not simply a statistical curiosity. It's a genuine signal that public health planning across the region may need fundamental reconsideration, rather than incremental adjustment. That reconsideration is already beginning to take shape in concrete policy discussions across the continent. Public health researchers and international bodies, including the World Health Organization, have specifically called for expanded cooling center access, improved real-time health monitoring systems capable of flagging at risk, individuals before conditions turned fatal, and infrastructure investments aimed at making buildings, transit systems, and power grids more resilient to genuinely extreme, sustained heat rather than the milder summer conditions they were originally designed around decades ago. The World Health Organization itself has described the broader situation as a health emergency, noting that heat has killed an estimated 200,000 people across Europe over just the past 4 years combined, a scale of loss increasingly comparable to other major public health crises that receive considerably more sustained institutional attention and funding. For anyone trying to make sense of what this all means at a personal level, the practical takeaway is genuinely important regardless of where you live. If mortality risk truly does accelerate disproportionately above roughly 40 degrees Celsius, then treating any forecast approaching that threshold with heightened seriousness rather than assuming existing coping strategies from previous. Summers will remain adequate becomes a genuinely evidence-based precaution rather than simple overcaution. Checking on elderly neighbors and relatives specifically during the most extreme days of any heat wave, not just during the general hot stretch surrounding it, reflects exactly the kind of targeted vigilance this new research suggests is most urgently needed. If you want to keep tracking exactly how this research develops, along with the real science behind every heat wave headline before it becomes tomorrow's viral clip, subscribe to the channel so you never miss an update. Stay cool, stay informed, and I'll see you in the next one, ready to break down whatever the mortality models reveal next.